Nearly 40% of teenagers are uncomfortable sharing sensitive information with their physicians. That's according to new data from the National Foundation for Infectious Diseases. In a survey of more than 2,000 teens, parents, and healthcare professionals, they found that while teens care about their health, one of the biggest barriers can just be getting parents out of the room and making teens feel more at ease. Dr. Leslie Walker, Division Chief of Adolescent Medicine at Seattle's Children's Hospital, gave some suggestions for what physicians can do to break the ice.
The teen is getting their own health information from the internet, from everything around them, from the television, and they may need to sit and kind of go over some of the information that they have, go over some of the things that they're doing that maybe their parents aren't as aware of. So I think it's real important to negotiate, to have a little time with the teen, even 5 minutes, just to hear what they're interested in. Without that, you can't really overcome that barrier. When you come into the room, going to the teen first, trying to make sure the teen's sitting closest to you. If you have some bench that you're sitting next to, having the teen be the closest to you, really speaking to the teen when you ask every single question, looking to the parent, for support, but really focusing the whole visit on the teen. That helps the teen know that you're there for them, and they can begin to respond. Teens are uncomfortable about everything. That's an uncomfortable time. So helping them feel comfortable, helping them understand that this is their place and you're there for them can break some barriers. Also letting them know they can contact you afterward. I find that to be really important. A lot of kids will try and reach out afterward, and that they can call and make an appointment, they can talk to the nurse, giving them both the card. Things like that give the kid a sense that this is their visit and this is their time. So maybe that first visit, they may just take the information in, but the second time, maybe they'll start to reach out and realize this is their doctor, their healthcare provider.
Aria Finger is the CEO of DoSomething.org, focusing on teen activism. She said understanding how teens reason can help physicians get their attention.
While teens do see the impact of what they do now for the future, short-term effects can be much more important to them. If they know that something they do today will affect them this evening, tomorrow, in the next 2 days, that's much more compelling than it'll affect them in 50 years. So figuring out how to make that, to shorten that time frame so they can see the immediate effects. And then we've also actually seen great success with social norming campaigns. And so when you go to a teen might say, oh, none of my friends go to the doctor every year. But if you explain to them, no, in fact, 2 out of 3 of your friends go to the doctor every year, they see that this is something that is normal, that everyone's doing, and that they should be doing it as well. So both shortening the time frame so they see immediate effects and also using social norms.